So, what is colon cancer? The colon, large intestine, large bowel are all words for the same thing. The small intestine digests all of the waste product and dumps it into the right side on the colon, and then things travel up and around and down and through the rectum where they exit our body. The colon's job is really to absorb any leftover fluid that is not digested from the small intestine and to get the waste out of the body. It's certainly not vital to nutrition or life, but obviously very helpful and welcome. The colon is supplied by a series of blood vessels that have little lymph nodes along the blood vessels that act as a normal drainage basin for the body, and they're relevant when we're talking about treating colon cancers. What happens is, if you really zoom in and look at the layers of the colon wall, what you'll find is that there is an inside lining called the mucosa, and that's made up of millions and billions of little cells that are doing their normal daily activity, and they have a very high metabolism to absorb the fluid and do their function. In order to keep the lining fresh and functional, those cells have to turn over very frequently, and so our body is constantly making new cells, and it's relying on DNA signals to make those cells. And so the DNA, when it's healthy, can do its function well, but when there is damage to the DNA, it causes either a faulty product or no product. And what happens is that the function then of the cells are damaged. And in cancer cases, what happens is the cells don't have the signal to stop growing, and they keep replicating and growing and form a mound of tissue, which becomes initially a polyp, but as they grow can become larger, and they can have more aggressive cells develop in them that start invading into the wall of the colon deeper, and that's when we call it a cancer. So colon cancer is a progression from a benign cell to an abnormal cell to a polyp growth, which we prefer to be able to remove by colonoscopy, which is why it's so important to get your colonoscopy before you have symptoms and not wait, because those polyps will keep growing and then eventually become a cancer. And then we need to know what the stage is in order to be able to treat it appropriately. A stage 0 means it's essentially just a polyp and not invasive yet. We stage cancers by the TNM staging system. The tumor depth into or through the wall is the T stage. The nodal status, whether there are lymph nodes involved around the colon, is the N stage, and then the metastases stage, or M stage, is whether or not they're spread to other organs, more commonly the liver or lung with colon cancer. And so when we're looking at this, a T1 or T2 tumor are stage 1 because they have not violated through the wall. T2 or 3 level tumors are considered stage 2 because they're involving through the wall or into other organs. Stage 3 or N positive disease means that the cancer has spread from the tumor. The cancer cells have now gone to the lymph nodes right around the colon, like we showed in that first picture. And then stage 4 disease means metastatic to other organs in the body. And so clearly we want to be able to treat colon cancer before it gets to that level, and obviously we want to prevent it from happening in the first place. How can we do that? By getting our screening tests and getting our colonoscopies to remove our polyps, but also by eating healthy. Why does colon cancer develop? A lot of it has to do with our diet, and the Western diet in particular is not very healthy for our colon. The World Health Organization has actually labeled processed meats like salamis and sausages and hot dogs and all that tasty stuff, has actually labeled that as a carcinogen because patients or people who eat a high level of those foods have a higher risk of colon cancer. So the food we eat, in addition to possibly the bacteria that are in our colon, lead to an environment that create damage to the DNA. That damaged DNA then leads to polyps, which can develop into cancer. So you can do a lot to prevent colon cancer by eating healthy, low amounts of animal fats and processed meats. It doesn't mean you can never have a hot dog, but you shouldn't be doing it on a daily basis. You should on a daily basis be focusing on poultry or fish as meat, high fruits and vegetables, high fiber diet. Staying healthy and exercise are important. Obesity is another risk factor for colorectal cancer, and smoking also is a risk factor for colon cancer, and not just lung cancer. And so there are a lot of things we can do to stay healthy and prevent cancer. We can't prevent all cancers, but a lot of colon cancer can be prevented by healthy diet, healthy lifestyle, and in addition, getting your colonoscopy at the appropriate time between ages 45 and 50, depending on which guidelines you follow and what your insurance will allow. And that's if you have no family history. So again, if you have a family history, you want to check sooner. You want to eat healthy, you want to live healthy. Hopefully this has been helpful. Thank you.